lot of us have struggled during this pandemic with physical health, but something we don't think of enough is our mental health, especially when it comes to kids.
And that's very, very true. 5 News reporter Tiffany Lee wanted to find out more about how kids are dealing with the mental health aspect during the pandemic and what parents can do to help them.
Kids and teens have been up against 2 very chaotic and stressful years. Those stressors, they can take a major toll on a child.
Counseling services tripled in the first 6 months that the pandemic was taking over, and the increase has been steady.
Dawn Sprague is the director of therapeutic services for TASK, Teen Action and Support Center, a Northwest Arkansas nonprofit that serves teens.
Nationally, the CDC reported between April and October of 2020, the number of mental health related ER visits increased significantly for children and teens. Take a look at these statistics. 5 to 11-year-olds, 24% more. They visited the ER for mental health reasons, and 31% of 12 to 17-year-olds. And here in Arkansas, counselors say that they're seeing the same results.
We've probably done more suicide assessments in a year than we had done in 5 years.
Showing counselors that the new norm may never feel normal for our youth.
We are distant even when we're together. We don't shake hands, we don't hug, we can't read somebody's facial expressions, and it feels a little bit, especially to teenagers, like rejection, like you don't want to connect with me.
While working alongside 13 to 19-year-olds in the last 2 years, Dawn has noticed the feeling of not being able to connect. It's become more common, and it's causing quite a few repercussions.
It's been a lot of kids struggling with anxiety and depression, primarily anxiety and depression, because of the isolation and the separation from people.
Affecting not only the big kids, but the little kids too, just in a different way.
One of the initial things that kids learn is that socialization of how to kind of function in a classroom, how to sit down, how to line up, all of that kind of stuff, how to play at recess. And by not having that, or having it be a little bit stifled and manufactured in how they interact, it has an impact on them. It's stressful to them.
But with this stress, there are some steps that you can take to help. Hayden Shepard, the Director of Intensive Child Services at Ozark Guidance, recommends parents and caregivers start with the basics.
Improving the time that you spend together, because everybody's so stressed out and we're in this stressful environment right now, that our quality time becomes very important. And it doesn't have to be goal-directed time together, so we don't have to necessarily have a conversation or about a certain topic or something. It can just be casual. Parents with young kids, get on the floor with them and play, and that's all you need to focus on in that time.
And if you don't see improvement after spending more quality time, then Hayden recommends calling a doctor to get a professional opinion, or looking for resources such as TASK within your community. But in the meantime, the best thing that mental health experts say you can do is reach out.
To find a safe place for them to get what they need, to be able to identify what they need, and then to be able to find a safe place to be able to do that. And there are safe places. It doesn't feel like it for kids a lot of times, but there are.
To help find those safe places, we'll have a few different contacts on our website. Covering news where you live, Tiffany Lee, 5 News.